Hey, I'm Dr. Bivens. I'm the hospital manager at South Buffalo Springs Animal Hospital. This practice has been here for about 7 years. I've been practicing veterinary medicine for 11 years total. I graduated from Tuskegee University in 2011. Since then, I was a general practitioner, associate veterinarian for 4 years. I've been managing my own hospital for about 6-7 years now. I focus and specialize on brachycephalic medicine and surgery. Those are all your smushy faces, your bulldogs, your Bostons, your Frenchies, your English, your Pekingese. They're their own special category. They have what's called brachycephalic obstructive airway syndrome. Big word for they can't breathe that good. So Airnetic has provided us great resources with oxygen so that we can keep these guys healthy, safe, and alive during exams, respiratory distress, anesthesia. Great working with you guys. When we started getting the groundworks of this hospital maybe 8-9 years ago, we were thinking we had to have an oxygen generator. So there has to be a location strategically planned for that on an external, safe area of the hospital. Easy to get to, easy to access, easy to maintenance. So we have our server room, we have our fire room, we have our oxygen room. Our architect sat down with us and said, hey, this is something that's going to revolutionize the animal field, the veterinary field. This is definitely something we're going to depend on. And once we get an oxygen generator, we're going to feel spoiled that we'll never want to go back. So when you're dealing with oxygen tanks, one thing you have to think about is the human side of medicine. The prices go up when we're faced with a pandemic. I think we've seen prices quadruple. In that time, that's not something we have to be conscious of as far as can we afford oxygen and can we treat our patients. When we have an oxygen generator, the pandemic, even though it's causing a great deal of havoc, when we have pets on oxygen or under anesthesia, that's not a big concern to us. When you have oxygen-dependent dogs like this little guy who has a heart murmur and congestive heart failure, sometimes these little small breed dogs need oxygen therapy, whether they have pulmonary hypertension, a ruptured chordae tendineae, or just acute heart failure. We need them around 30 to 40% oxygen. We couldn't have done that without an oxygen generator. These little guys, they like to get aspiration pneumonia, and they are oxygen dependent quite a bit. So when we're breathing in 21, 22% oxygen, and we need these guys at 30 to 40% oxygen for sometimes 1, 2, 3, 4 days, we couldn't have done it without an oxygen generator. If you're looking for on-demand oxygen, Airnetic is